Hi, I'm Mike from Turtle Medical. Today we're going to talk about the Daniel Baird Foundation Emergency Bleed Control Kit. As with all emergencies, the number one thing is to take care of yourself. You shouldn't go into a dangerous environment. You need to kind of check the area is safe before you go and help a patient. It's also really important to remember to call 999 and make sure you've got a paramedic coming to back you up. So the first thing we're going to do in any emergency is to check the danger, make sure it's safe for us, and then we're going to consider our own safety and that of the casualty. We're going to stick a pair of gloves on. So the gloves come in a kind of recyclable paper bag. It's all sterile. These are kind of a medium to large fit, so they're designed to fit the majority of people, and they are latex free, so they should be safe for people to wear. And now we're ready to treat a patient. Okay, so we're now going to show you how the code red tourniquet works. This is used in most of our trauma kits. So there's two different ways of applying this. It starts off with a nice loop. So if in this example you could slide it over the hand and work it above the wound before you put it on. But it could be that the person's arm is trapped under a piece of machinery or something like that, at which point there is a release buckle here. It even says release on it. If you push that, you can feed the strap all the way through, and that would then allow you to pass the tourniquet through under the arm and then back into the device. So there's a couple of options of how to use it. Once it's on in the right place, we need to place it above the wound, and unfortunately we can't really put it on the elbow joint, so in this case I'm going to go just above the elbow joint, and we're going to make this as tight as we can just by pulling the strap. And just so you can see on the camera, I'm going to slide the buckle underneath for this next stage. Move that part out of the way. So now we've got that on tight. We've got this section here, so we're going to move the white part out of the way, which is just Velcroed on. This is the windlass element of it. So as we rotate this and twist it round, it is tightening the tourniquet and putting huge amounts of pressure on the arm, and this is what's going to actually stop the bleed. So we keep twisting this until it's really tight, and then we can lock it into place on here. So it might be that we think we could do one more. We can't in this case, especially as it's on a training limb. There's not as much give as will be in the human body. So once we've got that as tight as we can, we then put this Velcro strip over the top. That means it can't easily kind of come out, and it also has a nice slot to write the time on. So all the tourniquets come with a pen. This allows you to write the time that the tourniquet was applied. This is really useful for the paramedics when the patient gets to hospital, so they know how long it's been on for. When they come to remove it, they might need to do different things about treating the blood in case it's become toxic because the tourniquet's on for too long. And that would then reduce or stop the blood flow to the wound. We would then use our trauma dressing, which is featured in some other videos, to wrap around the wound just to protect it, to make sure no dirt gets in there. If there is any kind of small amount of bleeding still going on, this will stop that from happening. More information about all of these kits can be seen on our YouTube channels, on our social media, and they can be purchased from our website, turtlemedical.co.uk.